Add-on treatments in IVF. There used to be a time when IVF treatment was reasonably straightforward. You took the eggs, you added the sperm, you made an embryo, you put it back in the uterus, and the patient got pregnant. But the reality is lots of patients didn't get pregnant, and patients got upset when they didn't get pregnant. And of course, doctors were upset too, which means patients would demand that the doctor do something new, something different, add on something to the treatment to increase the chances of the pregnancy happening. And these are what we call add-on treatments. And there's a wide range. Some of them are fairly low cost, simple stuff which lots of people do routinely without even being sure whether it helps or not. But since there's no downside, I think it's fine. These are what we call our low risk empirical treatments. These include things like maybe low dose aspirin or acupuncture or yoga or meditation. But there are other add-on treatments which are expensive and risky, but people are still happy to try it. For example, these are things like low molecular weight heparin or intravenous immunoglobulins or intralipids, things which haven't been proven to be useful at all. But because there's so much patient pressure on the doctor to do something new, something different, use a new test, use a new technology, and doctors are happy to oblige doing all these add-on things because obviously, the more the things we do, the more we can charge you for it. And it takes so much time and energy to explain to patients that these things don't really help to increase the chance of getting pregnant. But patients don't want to listen to the voice of reason. They want the doctor to do anything, everything, whether it helps, doesn't help, whether it's been proven, not even. So let's just try everything you can possibly do. And it's not just the doctor sometimes, it's often the patient who puts additional pressure because they've read something. Either they've read it on a website or a friend has told them, or they read about it in a newspaper, or it was a press release from some IVF clinic. And then of course doctors need to keep up with each other and compete with each other. So you have all these fancy things like IMSI and embryoscopes, which do not improve pregnancy rates at all, but do help to improve the clinic's profits. So doctors are happy to do it and patients are happy to ask for it because they think it will help. But the sad truth is that all these add-on treatments have not been proven to be clinically effective. Lots of research has been done to show that they're a complete waste of time and money. And this is becoming a huge problem in India, especially because of two treatments which are being so aggressively pushed because they're so expensive and so profitable. In fact, the cost of these add-on treatments can be more than the cost of the IVF cycle. And yet, doctors are pushing patients to doing these, especially because the previous IVF cycles have failed and they're telling the patient the lie that, hey, we do this additional test for you, it'll increase your chance of getting pregnant. And the poor patient's so desperate and fed up that they're happy to do anything which the doctor asks. One is called an ERA or an endometrial receptivity assay test, which checks how receptive the endometrium is. Common sense, isn't it? It's such a logical test. After all, you put an embryo into an endometrium which is not receptive, it won't implant. So let's do some more tests and find out. And it's such a fancy test. It does all kinds of genetic probes to find out how receptive the endometrium is. But what they don't tell you is that it's not been proven to be effective at all in clinical practice. And the second test is what is called PGT or pre-implantation genetic testing, which everyone seems to be doing left, right and center because they're saying, hey, we're putting an embryo, it looks good. But you know what? That embryo could have a genetic problem. And if it has a genetic problem, it won't implant. So doesn't it make sense to do a genetic test on the embryo? So we'll do this additional test, which means you need to do an embryo biopsy, you need to freeze the embryo, you need to send the blastomere for genetic testing, stuff which costs 3 to 4 lakhs. Like I said, as much and even more than an IVF cycle. And patients are very happy because it makes so much seductive, logical, scientific sense. But doctors don't tell you that none of this has been proven to help. And actually PGT reduces IVF pregnancy rates because not only is there a risk you're damaging the embryo, the truth is that a lot of these embryos which may appear to be abnormal on an embryo biopsy are actually quite normal because they can heal themselves and become completely healthy baby. So remember, there's bread and butter basic IVF that's extremely effective. And then you have all these add-on additional tests, technology, treatments, none of which have been proven to be effective. So be extremely skeptical when a doctor is trying to sell you on all these additional things. Otherwise, you'll end up wasting a lot more money and you will not be any closer to your goal of having a baby. And if you're not sure as to making sense of whether what the doctor's advising is sensible or not, please reach out to me. I'm an IVF specialist, happy to offer you a free second opinion on our website, which is www.drmalpani.com. We look forward to helping you to have a baby.